I'm Ursula Fletcher. I am a nursing quality specialist here at Mayo Clinic Hospital in Phoenix, Arizona. So when I was young, I had several role models who were nurses. And most of those role models were my aunties, my mother's sisters. So I had a lot of influence when I was young. I decided to go into this career because I wanted the opportunity to make a difference. I wanted to contribute to patients' healing journey and to make sure that patients felt better. My job is all about innovation and problem solving. And the problems that I'm solving is to make the hospital a safer place for patients and employees. So I work with a lot of different teams and different type of employees. I work with nurses, I work with doctors, I work with pharmacists, I work with all different type of specialties. And what we're trying to do is make it better for patients. As you know, there's humans who work in the hospital, so it's a lot of flawed processes. When you have a lot of humans, it's a lot of human errors. And sometimes those human errors can translate into medical mistakes. We don't want medical mistakes, but unfortunately, with the type of business that we have, it happens sometimes. And so what I do is I make sure that that data is captured, how many errors were made, how do we prevent those errors. I work with teams and lead teams, and we try to figure out what's the cause of those different errors. And we do something called a root cause analysis. And we start asking, why did this happen? What went wrong? And we ask why, and it's called the 5 whys. And we use that approach to get to the bottom of the mistake and why it occurred. So what I do is I'm looking at data. I'm very vigilant. I'm looking at trends in the data, and I'm trying to see where is it where we have gaps in care, and then how can I bring that information to leaders, to the leadership, to different colleagues, and say, look, there's an opportunity to make it better. And so that's what I do. I present data often. I present data, I facilitate teams, I work with teams, and we come together and we try to figure out what happened and how can we prevent that from happening again to another patient. I have had a very non-traditional career path getting to where I am today. I love the business aspect of healthcare and the clinical aspect. So I wanted a perfect blend between the two. So far I have been in the quality realm, and I love it. I already had 2 degrees in healthcare from a business standpoint. Then I got my bachelor's in nursing and worked as a bedside nurse for several years. And then I decided to go into quality management. And currently I'm in school again to get a doctor of nursing practice at Arizona State University with a focus on innovation leadership. So it has all come together, and I love it, and my goal is to lead innovation.